Welcome to Chats with the Chief. I'm John Jensen, Chief of Staff at the Veterans Health Administration, and this is the podcast where we make small talk about the largest integrated healthcare system in the country. This week, I'm joined by Ms. Monica Diaz, Executive Director of VHA Homeless Programs Office, where we will talk about the progress towards ending veteran homelessness and the collaborative partnerships involved. Enjoy the show.
Well, I want to thank everybody for being with us today. It's a great privilege and honor for me to have Monica Diaz on with us today from the VHA Office of Homeless Programs. It's the time of year where we get out and find those that are in our communities, veterans that may be homeless. And Monica and her amazing team do such great work to take care of those veterans every day. So pleasure having you here, Monica, and welcome to the show.
Thank you for having me. It's great to be here. Great to see you again, John. So very excited to be here with all of you.
Great. Well, we like to start every show off with really an introduction of our guest. VHA is an organization of people that cares for people, and so understanding and knowing about the amazing folks that we work with every day is important. And so we'd like to start off with maybe open the floor with you to maybe talk about who you are and how you got into this kind of work to start with. So we'll turn it to you.
Sure. So like you said, I'm Monica Diaz. I would like to say I'm originally from Puerto Rico. I'm a military spouse as well, mother of three. I actually joined the program almost 4 years ago. And, the reason I think that I was very interested to join the program more than anything when I applied was a lot of my own experiences and challenges approximately 10 years ago that myself and my husband is a veteran as well, that we experienced. And I have to say that it wasn't for the help of the community, of VA, of many partners, the local church, the good neighbor. We would not be here today. We did struggle at that time significantly in terms of resources, and certainly I was very blessed to have, and be able to have the access to VA and all the resources that were in that local community at that time. And so after that, I thought, I remember telling my husband a year after, and then we came through that successfully by grace. I said, at one time in my life, I want to do something in my work that would be towards the mission of helping homeless people. And so this position became open, and I applied and got the job. And so it truly, I feel so fortunate to do what I do. But I have to say, VA was just a great partner. I even remember the name of the case manager who
Wow.
assists us and help us. Yeah. So that's part of the reason why I'm here. Besides that, as I said, I'm a military spouse, and I have a special place in my heart for veterans.
Well, we're really glad to have you. You have an example of the people that you work for with every day, and that's key, I think. And it's something I say all the time about the VA. It's people helping people, and then we get into that business because of that. So thank you for doing it, and thanks for joining the VA 4 years ago. I actually remember that day clearly, one of the first days when we started, so welcome. Some other questions that we like to always start our show off with is some questions to kind of really get to know you, our guests, a little bit better. So is there a book, TV show, or movie that you're watching today that others might be interested in? By the way, I always take away from this and go look for that book or TV show. So.
That's a good question. I actually am a boring reader. You can see on the back all the books that I have. I have a ton of books, even in boxes in the garage. That's how much I read. Recently, not a recent book, but I will say on my top 5 books, one of my favorite books is Still Alice. I think it was published around 2007. There's various versions. The one that my preference is the one from Lisa Genova. I think that's the name of the author. But it's a story of just a wonderful woman named Alice, and she is so smart. She's a subject matter expert in the United States and in the world, quite frankly, in the topic of linguistics. I think that was her subject matter expertise. But she was a professor in a very important university, very well known, again, in the United States and globally. But she then gets Alzheimer's around her 50s, which is early onset of the disease. And she starts losing her memory, her mind, her knowledge, obviously, because she's not able now to remember all the information and everything that she used to teach. So no longer she is a subject matter expert suddenly. No longer she can do what she was known for. And I remember reading this book in a 3-hour flight in California, just in one sit. I took the book and I just read it in one sit. And it was, the thing that I like about the book is that it reminded us, and I think we all know this, but I think we need to be reminded. It reminded us about what life is all about. You know, she lost her job. She lost what she used to do, but she still Alice, how the book calls it, right? Wow. Still Alice. And I think it reminds us about humanity. We sometimes, our society can focus a lot in what we do, what we have, or the awards, or the recognition, or how much we know about something, which is awesome. You know, those are great things. But at the end of the day, we're still more than what we do. We are who we are in our own humanity. And I just love that piece and that reminder of the book. And, you know, it's about what unified us as people and how we treat each other, and that we hold value even without all those things. We're as valuable as with all those compliments and all those additions, right? And so it's a great book. I will recommend it to anybody. I actually read it approximately every 2 years, just chapters here and there. Yeah.
Yeah, that's great. Haven't heard of it, but I'm definitely going to look for it in my bookstore. That's fantastic, and the humanity of humans is a key thing to what you do every single day, and to look for that humanity in what we do, and to find those people that can help care for those that may need some care. So that's fantastic. Yeah. Another question we always ask: is there something interesting or unique about you, or a hobby that you may have that others may be kind of surprised that you have?
Something unique. Well, I already said, I always like to say I'm from Puerto Rico and it's my island, and I always say that proudly. I think that some people don't know I have 3 kids, and 2 of those kids were born within the last 3 years, so one after the other.
So that's your hobby, is your children.
I know. Yeah. I know. And one unique detail about this is that the 3 kids, when I mention them, they have, all of them have a middle name. And I always don't call them for the first name. I always say the full name. And people are like, probably, why is it just like a long name? And the reason is their name translated in Hebrew or Greek has a meaning, a specific meaning of the season when they were born. So, for awareness, my first one is 11-year-old. Her name is Sophia Luz, which means light of wisdom. There's a lot of, I feel that season when she was born was just full of wisdom and light in my life. It was just, that's how it was at that time. Just as specific things were happening that were very special. Then the second one is David Noah, which translated means beloved rest. And when he was born, it was just a season in my life that was just so peaceful. That was a season of just peace. And the third one, which is 2 years old, very active, is Victoria Rain. It means victorious blessing. And she was born just at the moment that the pandemic came. And I just felt that I was just going to proclaim that it was going to be victorious blessings in the years to come, because the pandemic was just so difficult and it was challenging, and so I named her that way. So that's an interesting fact about me, and I will just say in terms of hobbies, I love interior design. Okay. I have loved it all my life. Drives my husband crazy, but I love interior design because every year I'm doing a new design in the room, and it's a whole deal. Okay, it's light, it's texture. I paint. I do painting. I paint. everything. But I loved it. It's a stress relief. It's just I can do it every day, all the time. So that's another interesting detail, perhaps, that many don't know.
I love that detail, and I'm sure that here at Central Office and many of our facilities could utilize some of that uptick in some decorating going on. So that's great.
Anytime.
Another question we like to ask is about a saying, a quote, or some piece of advice that you've ever received that you just really hold on to. And it's maybe that's something that you share with others all the time that you also have received.
I think probably there are two things that come to my mind when you ask that question. One of my favorite ones is, it is a new day. I think as leaders, as parents, as community members, especially more lately, right, with everything that we have faced in our country with this pandemic and those challenges, I think we need to remember that it's a new day. Every morning is a new morning, and that means new opportunities. It means that what happened the day before, or the bad things, or the challenges, or the disagreements, or the disappointments, whatever it might be, you have a new day, you have a new morning, and that means that there's opportunities for new grace, for forgiveness, for starting fresh, and not hold all those things within your heart and keep your heart clean and in the right place to do good and to be happy and to be peaceful and to be joyful. So I like that one a lot. I say that a lot. I said, it's a new day. It's a new day. So there's a new opportunity to look at this with fresh eyes. It's a new day. So that's one. And I think the other thing that comes to my mind is that I try to remind myself as much as I can. And I think, some days I fail at it and some days I do good at it. But I try to remind myself that when there are challenging situations or things are difficult, whatever it might be, it can be a health situation, it can be personal, it can be, work related, it can be many things, especially, within the last few years in our country. And again, the pandemic has brought so many dynamics. I think that I try to remind myself to not, despite the challenges or the bad seasons, what we consider bad seasons. I think that there is beauty in the mess in the middle. And sometimes we just want to see the result right away. Right. We tend to be a little bit like, I want to see the result. I want to see the good thing. I just want to, we all want to have only good things happen to us. I know I do. 24/7, that's what I want. But that's not the reality of life, right? So I try to remind myself, you're right now in the middle, Monica, maybe on something, and it's messy, and it looks ugly, and it feels uncomfortable. But it's still beautiful because it builds your character. It builds wisdom, understanding. It helps us to become better, at the end of the day. So I think those are my two, mantras or thoughts that I try to keep for myself, and at the same time kind of help others or team members as well to look at a little bit in that aspect when needed.
I think those are all great, and it's always nice to share and hear things from our leaders about what they think of to get them through the day every day, as well as to share with their staff as they also go through their day. So let's talk about veteran homelessness. And as I kind of started, everyone knows that veteran homelessness is a problem. It's an issue that we all need to address and be a part of addressing, and it's a sad thing when we see veterans that are homeless. And so let's talk about, so recently the Housing and Urban Development report from 21, the PIT report came out, and we had seen a decrease in veteran homelessness, which is fantastic. But maybe you could tell us a little bit about that report and kind of some of the key findings that you found in that report.
Yes, so the point in time count is led by HUD, the Housing and Urban Development Agency, and we, VA, collaborate as many times as volunteers and partners, and we're so committed in that partnership. For for broader context, when they do the point-in-time count, there is efforts led by the community. They bring volunteers. We participate. We do the counting in the community. We get the demographic information and fill out the survey for the homeless people and veterans that we're counting at that time. And the point-in-time is a snapshot as well that we utilize to see how our goal is moving and the progress that we're making, right? For the odd years, the process that has always been is to count the shelter and on-shelter veteran homeless population and veterans, homeless population in general. For this last particular count, not all the communities were able to do the on-shelter count because of COVID, all the restrictions that were there. But we were able to account still for the shelter numbers. And what we saw on the last report was that there was a significant decline in the shelter veterans number. It is approximately a 10% decline, and it's the largest one-year decline in shelter numbers since 2015, approximately at that time. So that's significant, right?
Yes.
We certainly celebrate the progress, right, that has been made in the program. We as well acknowledge that there's more that we need to do, right? And so this is just an encouragement to really continue to do more and more and more to serve. I would like to highlight that, when it comes to the PIT count as well, the engagement of VA, and we just did the PIT count just recently for the 2022. The numbers of those have not come out, but, leadership was involved, volunteers for all the VA medical centers. So I say that because the results of the last year, and not only that, but through the last decade, which is a reflection of almost 50% decline, it is truly a reflection of the commitment, the broad services that are provided, and just the people that are willing to continue to be relentless and deliberate and intentional towards the mission.
Yeah, and I was blessed enough to participate in the DC PIT count just several weeks ago, I guess, with some amazing VA staff, including the secretary, and it was a eye-opener. But some of the other things, not just in talking to homeless in our communities, but also providing them maybe assistance with finding a shelter for the night, or finding a place for a meal, or transportation, or food. And as you mentioned, it's a community-wide approach to this. And you lead the VA side of that. So maybe you could talk a little bit about the VA Homeless Program Office, and what is it that you do? And as a side to that, what does the VA do for homeless veterans?
Yes. So I always say we have a unique service approach. And a lot of the times when we think about homeless programs and homeless veterans, we're thinking, so the homeless program probably, help the veterans to get housed, and that's what we do. Yes, that's what we do, but we do more and more than that. So our goal in the Homeless Program Office is truly to have a systematic approach to end veteran homelessness. And when I say that, I say it because at the end of the day, then our systems and our portfolio and our programs are geared to have that systematic approach, right? And that's why they're so comprehensive as well. So what does that mean in the first place? When we say that our goal is to have a systematic approach with our services to end veteran homelessness, is to make sure that every community, as much as possible across the country, is able to identify immediately any veteran that is homeless. They're able to immediately shelter those veterans that are in an unsheltered situation, and they can do that right away. They're able as well to house veterans immediately and or have the capacity to make sure that we address those needs of those veterans, so we don't have this recurring situation where veterans are coming back to homelessness, and that we're able to as well prevent homelessness at any time possible. So with that in mind, our portfolio in the Homeless Program Office has targets a variety of services. including prevention, including outreach services in the community. It includes as well transitional, grant per diem. Our program for grants has transitional beds across the country. We have our healthcare for homeless veterans programs that as well provide emergency shelter beds as well and services. And we have our SSVS program, which provides supportive services as well. And within that, not only that, we have programs as well that what I love is that it's in partnership as well with others. And an example of that is HUD-VASH, in partnership with other federal agencies. HUD-VASH provides the vouchers, HUD provides the voucher, and we, VA, provide the case management. So it's a very holistic approach to homelessness. So it's not only the housing piece, but it's the case management piece, the whole aspect of what that veteran needs. One of the things that is unique as well about the program is that we have the homeless program within VHA, Veterans Health Administration. So we think about it, we have all these services, but now we are in a very comprehensive healthcare system, right, which then the veteran as well can benefit from primary care, geriatric services, mental health, suicide prevention services, and other, you name it, all the other services that are included within VHA. So it truly helps address individual need and the root cause that is causing or precipitating homelessness in that individual, right, and their family. One of the things as well, and I will mention two things more, but one of the things that we do as well is we help the veterans obtain meaningful employment, and we do as well serve veterans that have encountered the justice system and help them get access to care. So if you look at all that, it's truly, again, very comprehensive in all the different areas where homelessness can be impacting, right, or can be touching the life of someone. And I will say, besides the VA system, what we provide, the resources that we're able to allocate for all these strategic services, is the fact that homeless programs in VA addresses homelessness in partnership. And this is one of the things that I always like to say is in partnership with others, with other federal agencies, with the state, with the community, with nonprofit organizations, private organizations. So it is very well acknowledged and recognized that homelessness cannot be, ending homelessness cannot be achieved by one agency alone. Right. It is truly all of us together. And we do many of these services with that collaboration, which I think is very unique and is innovative and is what really has caused progress within our results.
Yeah, I agree, and that's fantastic information about really how it works and it correlates. And as the largest integrated healthcare system in the country, I think a lot of people don't really know that there's no other healthcare system that does what we do for homeless veterans and for homelessness. So maybe you could describe, as I mentioned, we're the only kind of agency that does that, the only system that does that. What do other healthcare systems do for ending homelessness?
I think that because it's a very complex issue, other systems, it depends on the community needs. So each community really have their own unique situations and challenges. And as we work with them, we provide, technical assistance many times in collaboration with others, what we have learned very clearly is that there's not a concrete answer across the board in terms of addressing homelessness. So what we have learned is best practices based on the unique challenges of each community. And so keeping the perspective of that is key. Some communities are focusing significantly in addressing prevention. They notice that this is an area that they need to really address more closely, and they do look at best practices in that area. Other communities are really addressing the need that they have pertaining to housing, for example. They need more of the housing stock. They need more strategies with that, and we need to expand that area. Project-based vouchers and amplifying the housing stock and strategies on that. Some other communities, the need is more strongly meeting the need for the unsheltered population and strategizing in ways to have a more targeted approach included through the coordinated entry system that they have at the local community level. So it is very unique. And the beauty of this is that as we hear the different best practices across the nation, being able to collaborate together and learn from each other, but recognizing that no one here at the top dictates the best practice at the community level, but the community tells us this is where we need help, this is where you can partner with us, and having that approach is truly the key of success across the country. I will say that is common across the country, letting the community define the need, and we tap there as their partners and addressing those. And at the same time, then sharing those best practices across the board.
Yeah, you mentioned the best practices, and it's an example of how we as an integrated healthcare system are able to share those a lot quicker than maybe other organizations are. Is there a venue or avenue that you utilize in order to share those best practices, not only inside VHA, but also with other agencies and local and community partners?
Yes, so there's various means. Internally within VA, our program office, we do have national calls to share best practices with the VA medical centers, and where the VA medical center shares it with us, right? Because they're the field has a lot of sources of information, and we just are the platform to share that and evaluate that, and at the same time disseminate that more. We do have in the Homeless Program Office, our National Center for Veteran Homelessness, which they help disseminate research and information as well on best practice, and they do an excellent job in doing so. And we have as well an educational portfolio there where in many times we do webinars as well across the nation, which we invite not only, VA staff, but we invite community members, we invite other partners, and we share information and best practices and most updated research information that we have pertaining to what we do. One of the things that as well we do is we do technical assistance calls, and so that varies. That might be a particular community, and then we are discussing best practices for that particular community. And we do have as well a platform internally for VA where we include there all the best practices that we have found or that have been shared with us, so that all the VA medical centers can have accessibility to that, all the visitors can see that, all the staff, including at the field level, can have access to that. So it can be just available immediately as well for the staff if they're experiencing a need, a challenge, and they can maybe tap into solutions that are already there.
That's great. And again, integrated approach to care is how we're so successful, and that's a great example of that. You mentioned, you've really described a lot of the successes that's taken place in getting veterans into housing. And I know there's still some challenges out there. Are there some specific communities that are being affected by it? And if there are some communities that may be still challenged, what's maybe the factors that's leading to that?
So it's a big question, but an important one. Certainly there is very unique challenges for the different communities when it comes to homelessness. Some of the challenges might be resources allocation. There might be as well staffing needs, right, to address the case management aspect of the veteran. It might be as well data information, integrated data information, so you can really manage, the information at the local community and really assess what are the next steps for coordination. The other piece, and one of the big ones many times, is the housing stock. You can have even all the resources, all the funding, but if you don't have the housing stock in that community, then you're not going to be able to house the veteran, right? And so it's very unique in each community. We have certainly identified that on the West Coast side, the cost of living and the housing stock is one of the areas that we certainly is a priority, and there's a need that is impacting homelessness. But again, each community is different, and the way we address it is similar to what I mentioned before, is the partnership with them, and there's many ways in doing that, from technical assistance call and support, from best practice, sharing that, and at the same time coming up with innovative and practical solutions. One of the things that we have done recently, especially with the new flexibilities and the funding and appropriation during the pandemic, is to really amplify on those innovative approaches, because resources are there. We are resources that we can now, expand maybe national initiatives to support the mission, of ending veteran homelessness across the board.
Yeah, you mentioned the pandemic, and it's affected all of us in our every single day over the last 2 years, 2+ years now. How does that affect our homeless veteran population, and what are we doing to address it?
Yes, very important topic, and we thought maybe that we would not be talking about the pandemic today, but we still are, right? 2 years after, I thought it would, I was hoping that by now we will be perhaps in more going back to that sense of where we were before the pandemic, right? And I think we're going there, but we still within the current situation, and so we still need to be vigilant and monitor and making sure that we're doing everything that we can. So interestingly enough, when we think about the pandemic and we think then homeless veterans and homeless people in general, it is one of a critical issue, because if we think about homeless people, they're in the street, right? They're more vulnerable to this pandemic. They don't have the hygiene equipment. They're cannot apply all the CDC guidelines because they're living on the street. So it is very, very challenging in that regard. So because of that, we made, in the homeless program office, we made a priority the efforts and the strategies that we needed to have in an effort to address the pandemic effectively. We have a significant amount. I just have to say, I have to credit the staff. The pandemic started when I was actually on maternity leave, and we had great people at the field level, at the VA Medical Center, the leadership in the homeless program office that just led with remarkable heart and commitment. One of the things that we were able to do was to ensure that we utilize the support and flexibilities that were granted for us. And we got a lot of support from Congress. VA was amazing in their support. And one of the resources that we got was the CARES Act that many of us have heard, right? And so that gave VA approximately over $17 billion in funding, and approximately over $900 million of that funding was specifically to address the needs of the veteran homeless population during the pandemic. That allowed us to increase the support and services that we were providing. How? An example of that is placement in hotels and motels. We end up doing that. If we think about even shelters in the community, it's a congregated setting, right? The hotels and motels allow us as well to provide a safe environment for the veteran that immediately can be housed in those circumstances. We have thousands and thousands of veterans placed in hotels and motels. The number keeps evolving, but if I'm not mistaken, by probably, in the last 2 weeks, it's over 40,000 veterans that we have placed in hotels and motels. And again, that number keeps evolving because we keep placing them, right? The other thing is that the CARES Act did allow us to waive, the cap of the per diem rate for the grant per diem grantees. And what that means is that they have the ability to, for us to pay them a higher per diem rate for the things that they need to really support the care of the veteran. And we think the cost, the service that needed to happen, the operational logistics with COVID is certainly a little bit more challenging and more labor intensive as well. So we were able to do that. We enhanced as well the services to our healthcare for homeless veterans. We were able to expand as well significant flexibilities there in supporting as well from even gear equipment, staffing, and as well placement in hotels and motels through them. So I think that it was extremely key for emergency housing, especially in a pandemic. The other part that was very interesting with COVID is that it really challenged the way that we did outreach. If we think about outreach, it's face-to-face, right? And that's how I always done outreach. But with COVID, especially at the beginning of COVID, they were not, the guidance was, more of isolation, not face-to-face interaction. So we really needed to tap into virtual outreach more and think out of the box. So, as an example of that is, as of today, we have distributed over 50,000 mobile phones to veterans. And that is very important. If we think about what the pandemic did in terms of engaging with people and having the ability to connect with them, it is extremely important. And we have received so many great comments and feedback from veterans that have received the benefit of having a mobile phone with them. It has allowed them to have immediate engagement with the VA system. It has allowed for the case management to have access to that homeless veteran that maybe is by themselves and alone and monitor that they're doing well. It has allowed for virtual housing options and placement and job search as well, right? So it has a significant benefit. And for telehealth as well, we have approached that in that virtual aspect. So I think that those innovative approaches were critical. We continue to do those. And I think we will continue to evolve in those because I think the pandemic is creating a new normal.
Right.
And we are realizing the benefits of that. I think one key as well is the Veterans Health Care and Benefits Improvement Act. That as well gave us other flexibility where we can use appropriated funds for specific services and goods that we were never able to utilize and provide. And so some veterans have been able to receive meals, clothing, vouchers for laundry, so many different things that in the past maybe we were not able to do. We have amplified as well with that funding and that flexibility a national coordinated ride-share program. And what that means is that we have been able as well to amplify the services for transportation for the veteran. And that includes transportation for legal services, for support for health care. I think that the support that we receive, plus the intentionality, the deliberate effort, the commitment from the agency, from the staff, and this national emergency, it has been significant for all of us and to ensure that we continue to have progress. I am personally very proud of all the efforts made. I think there's more to be done, but I'm proud of the support given for the administration. I'm proud for what the staff is doing, and we will continue to do that.
Wow, I didn't realize all that had happened, but it makes me think that the pandemic might have a little bit of a silver lining for our homeless population in that the isolation that may have been felt previously where you're not able to do that outreach or have an opportunity for our homeless population to outreach for health care now through even just a phone are able to be outreach to and outreach to others to have a connection or to their social worker or for primary care or mental health care or just in need of something. And so that's really fantastic. I'm so glad that was all able to coalesce, even in this unfortunate time of the pandemic, into really finding some successes in there. So here, in our offices here in central office in D.C., about one block from the White House, but also one block across diagonal from us is a homeless population that I see every single day on my way into work. And so it's a reality to us and to me and to many people in communities. And so as a veteran and an employee of the Veterans Health Administration and a community member, I guess I would like to know, what is it that I can do? What more can I do to help our homeless population, veterans, and just our normal homeless population?
Thank you. No, thank you for asking that question. And I think all of us at one point or another, we're outside, right, on the street, and we see someone that is homeless and that is a veteran, and we ask, okay, what should I do, right? And I've been on those situations frequently when I'm out and have a plan when I see them now, right? And there's different ways to approach it as well, depending on what the veteran as well is willing to do at that moment. Everybody is in a different place at the moment to accept help and to engage. And I think it is very important to know our options in terms of helping that veteran engaged and bring them into the system and provide them the support needed and how to do that. So there's different ways. You know, one thing is I'd always like to tell people an option that you can utilize in an area that we have recommended always is making sure that we connect that veteran with the local VA medical center. The local VA medical center can then provide assistance to the veteran. So, for example, I have seen a veteran in the street in Orlando. I live in Orlando, and I do actually community work for homelessness. And so it's frequently that I will see a veteran that is homeless. And so what I would do is, if they're willing, right, I get their name, and many times I can do the referral myself, or I am providing them with the information. Usually I do both. Some veterans at that time, they're not ready for that. And so when I see them the next time, because I'm in the same volunteer group, I then follow up and kind of approach them and engage them again. So referring them to the VA Medical Center, giving the information to the VA Medical Center program, homeless program, is key. So you can call just the VA Medical Center in that local community, the closest to the veteran. The other option, which is very critical and is a good one, is the call center that we have. The beauty of the call center is that it's 24/7. And I'm going to give the number here, is the National Call Center for Homelessness. And the number is 877-424-3838. 877-424-3838. The beauty of the call center is that it's 24/7. So let's assume, and I have seen this when I have met a veteran that is homeless, and they're like, "No, I'm fine. Tomorrow I would like to talk to you tomorrow." Many times I have given them the number of the call center, and when I see them next time, they're already engaged with someone. They have something already that is going to be scheduled. They're already on the path because they at a later time, decided to call that call center. And the call center will do the screening of the call and then making sure that they do the proper referral to where they should, tap into in terms of the resources. And then the other way to help, depending on the situation, even if it's for prevention, maybe someone is not homeless yet and they're at risk of becoming homeless. We have a website as well, and in the website you will see all the resources that we have. But at the same time, you will have contact information of people that you can call on that locality, regionally as well, to gain access and then immediately tap into the resources that we have. The website that we have is va.gov/homeless/stakeholders.asp. So va.gov, but within that, looking for the homeless page in there, and you can then have all the information provided as well. If you're not in an emergent need, it's a great resource as well, in the sense that, again, you can see all the resources or the transitional beds that we have across the country. You can see all the grants that we have, the different programs that you can tap into. But again, the specific content that you can call, and sometimes we just need that immediate content to get more information pertaining to the programs. Those are the immediate, advices that we give to people in terms of helping. But I would like to add one more. I think that we have a number, we have a website, we have the local VA Medical Center, but it's something that is very critical when we're trying to help someone is to meet them where they're at.
Yeah.
And I think sometimes in an effort to help, we can forget that when someone needs help, sometimes the person will realize that they need help. Sometimes they don't realize how much help they need. So meet them where they're at. I always say that homelessness, to help someone that is homeless, you need patience and sometimes a lot of deliberate intention in your engagement. Because many times there's a lot of trauma, there's a lot of underlying issues. So I say not giving up on people. At the end of the day, no one wants to be living on the street. No one wants to be not well and happy. But sometimes we don't know that. And so having that intentionality and making sure that we all know that it's not someone else's job to help, but it starts with us. If we're seeing the person right there, it starts with us. It starts with us. That's the other part of that I'd like to mention, because I think it's important that we all see ourselves as the key members to end homelessness, not an agency, not a group. We all, as citizens, have a responsibility to end homelessness, especially for our heroes.
That's well said, Monica. You're spot on, I think, and it takes each of us in order to do it. And everyone gets into healthcare and comes into this administration because they want to help people, and that's a population we all need to seek out and be able to look for opportunities to assist. And it's nothing more eye-opening than being out on the streets on the pit count just a couple of weeks ago here in D.C. at 19 degrees and finding people that didn't have a place to stay that night. Did not have the clothing necessary to survive temperatures at that level. So it's very important to me, and I know it is to you, and it's important to many people in the VA. And I really appreciate you taking the time and coming on the show today to talk about it. It's something that we have to continue to face and focus on and put our energies toward in order to solving it. And so as we close, I'd like to turn it over to you for any closing comments.
I just want to, first of all, thank you for giving us the space for the homeless program for me to share this and share information about the program. I just want to say a couple thank yous. That's how I want to end this. I want to thank the staff at the field level and at the program office level. This has not been a common year, right, or the year prior. There has been a lot of work. There has been a lot of changes and challenges with this pandemic, and the fact that the staff still committed, heart and soul to this mission. I just want to thank them. It requires special people to do this type of job, and the program can do as much as the people. So I just want to say thank you to them. I do want to extend my thank you as well, and acknowledge, especially this last 2 years as well, it has been a team approach. Is to the VA leadership. VA Health Administration and VA leadership has truly have been committed to this mission. And without the leadership support as well, we cannot make progress. So I just want to extend a thank you to you, John, for your support, for VA Health Administration support. My leaders are amazing, for VA, and for the federal agencies support. All the different federal agencies are so much on board with this mission, and the communities that it has been amazing, and we have pulled together even more because of COVID, ironically, right?
Yeah, right.
But it has got us this is why we need to work together, right? So I just want to extend the thank you and encourage everybody to continue with that intentionality, to continue with the faith that we're going to continue with that dream of ending veteran homelessness. So thank you, John.
Thank you, and I agree with you. We need to all do something, our own parts, to end veteran homelessness. Monica, thank you so much for being here. Thanks to this amazing video team that brings us to you all the time. And thank you for watching. Have a great day.
Thank you. Bye-bye.
Hope you enjoyed today's conversation. A huge thank you to all of you for listening, and to Ms. Diaz for her time. Join us for our next episode, where we get a chance to chat with Ms. Bryn Cole, Director of Design and Storytelling with VHA's Innovation Ecosystem. See you next time.